A patient with the delusion of thought insertion, they believe that an outside agency has implanted certain thoughts into their mind. So that's a delusion of thought insertion, and it is one of the first rank symptoms of schizophrenia, and is also in many cases associated with an explanatory delusion. So the patient may, for example, believe that the persecutors have used radio waves to insert these thoughts into his mind. So delusion of thought insertion is a delusion in which the patient believes that his thoughts are not his own but have been implanted by an outside agency, and is associated often with an explanatory delusion that the persecutors have used radio waves or some other bizarre mechanisms in which they have implanted these thoughts. It is important, however, to differentiate the delusion of thought insertion from an obsession, because in an obsession, the patient's thoughts again are intrusive thoughts, but these thoughts are considered to be the product of his own mind, not to be implanted by an outside agency. So that's how we differentiate between a delusion of thought insertion versus an obsession. And it is important in both cases when the patient presents with an obsession, so it is important to differentiate it from thought insertion. While if the patient is having thought insertion, so it is important to differentiate it from an obsession. But the whole picture, for example, a patient with thought insertion doesn't just have a delusion of thought insertion. He is expected to have other signs and symptoms of schizophrenia as well. As I said, this is a first-rank symptom of schizophrenia. So in most cases, the underlying diagnosis is expected to be schizophrenia. And so they will have other signs and symptoms of schizophrenia. And a patient with obsession will have other obsessions and compulsions as well.